All right, today we're going on a little expedition. We're going to take a tour of a place you use every single moment you're standing or walking, but you've probably never given it a second thought. That hidden, complex world right behind your knee.
I mean, it just seems like the back of your knee, right? A simple joint. But it turns out that little hollow is one of the most crowded and critical intersections in your entire body. So, what is actually packed into that tiny space?
So here's our game plan. We'll start with a general overview, then we'll map out the borders of this little territory. After that, we'll navigate the superhighway of nerves and vessels running through it, expose an anatomical imposter, and look at what happens when things go wrong. And finally, we'll wrap up with why this little spot is so darned important.
Okay, first things first. Let's get our bearings. We're diving into a region that is, for all intents and purposes, a critical superhighway. It's the main route connecting the powerhouse muscles of your thigh to everything in your lower leg.
Now, the official name for this area is the Popliteal Fossa. You can feel it right now. It's that diamond-shaped hollow on the back of your knee when you bend it. But don't let the word hollow fool you. It's not empty space at all. It's more like a tightly packed pipeline, making sure all the power from your thigh and all the control signals get down to your foot and back again.
So, like any good explorers, before we venture into this space, we need a map. We need to understand the borders of this diamond-shaped territory. And as it turns out, these boundaries are all formed by some really powerful muscles.
Every map needs boundaries, right? Let's start at the top. The upper inner side of our diamond is formed by two of your major hamstring muscles, the semimembranosus and the semitendinosus.
And directly across from them, forming the upper outer border, is another big-name hamstring you've probably heard of, the biceps femoris. So right there, those muscles create the upper V of our diamond.
Now, let's move to the bottom half of the diamond. Here, it's all about your main calf muscle, the gastrocnemius. Its inner or medial head forms the lower inner border.
And you guessed it, its outer or lateral head forms the lower outer border. And boom, just like that, with those four muscle groups, we have the complete outline of our diamond. We've mapped the walls.
But here's the really crucial part. This isn't just a flat, two-dimensional shape. It's a three-dimensional space. It has a tough, fibrous roof covering it and a hard floor made of the femur bone itself and the back of the knee joint. It is a true, contained anatomical compartment.
Okay, so we've mapped the borders of the neighborhood. Now it's time to check out the high-speed traffic that's barreling right through the middle of this thing.
You know, navigating such a crowded space would be pure chaos without some kind of organization. But luckily for us, anatomy has an incredibly simple, unbreakable code that tells us exactly how everything is arranged. And it's just 3 letters, NVA.
This is brilliant. It tells you the exact order of the main structures from back to front or from superficial to deep. The very first thing you'd find, closest to the skin, is the N, the nerve, the tibial nerve. Go a little deeper and you hit the vein, the popliteal vein. And deepest of all, tucked right up against the bone for protection, is the artery, the popliteal artery. Nerve, vein, artery. NVA. It's that simple.
All right. Every good tour has a little twist, a little mystery. And here in the popliteal fossa, there's a very common anatomical imposter, something that can fool even experienced students of the body.
Meet the plantaris tendon. This thing is wild. It comes from a tiny, almost insignificant muscle, but it has this incredibly long, thin, string-like tendon that runs down the back of the leg. And because it looks so much like a nerve, it is the #1 cause of mistaken identity in this whole area.
So how do you tell them apart? How do you spot the imposter? Well, it really comes down to a few dead giveaways. A tendon, like the plantaris, is going to be a uniform pearly white color, and it feels tough, like a cord. A nerve, on the other hand, usually has a slightly yellowish hue. But here's the real clincher. A nerve will give off smaller branches. A tendon never does that.
Now, because this space is so crowded, because it's such a major choke point, it's also a hotspot for certain clinical problems. So let's take a look at a couple of common hazards you might find on our superhighway.
First one up is the Baker cyst. This is basically a bulge you might see or feel behind the knee. And no, it's not a tumor or anything scary like that. It's just a sac filled with excess joint fluid that's been squeezed out from an irritated knee, usually because of an issue like arthritis.
And what's absolutely fascinating is that it doesn't just form anywhere.
It almost always pops up in one very specific spot, a little gap between the semimembranosus tendon and the medial head of the gastrocnemius muscle. Hey, wait a minute. Those are the two muscles that form the upper and lower inner borders we just mapped out.
Okay, another major hazard involves the nerves. And the data here is pretty striking. The common fibular nerve, which runs right along the outer edge of our diamond, is the single most frequently injured nerve in the entire knee region. Number 1.
So why? What makes it so vulnerable? Well, it all comes down to its path. It travels in a very exposed, superficial location as it wraps around the top of the fibula bone. This basically makes it a sitting duck for everything from direct impacts and fractures to compression from something as innocent as a tight cast or even just crossing your legs for too long. So we've finished our tour. We've navigated the highway and we've spotted the hazards. What have we learned? Why does this small patch of anatomical real estate matter so much? Let's just quickly summarize.
Okay, here are the absolute key takeaways. Number 1, the NVA rule is the secret code. It tells you the whole layout. Number 2, the path of that common fibular nerve makes it incredibly vulnerable to injury. And finally, remember that the whole fossa acts as a natural choke point. That means any swelling from something like a Baker's cyst can very quickly compress all those vital nerves and vessels packed inside.
You know, when you step back, the popliteal fossa is a perfect example of the body's incredible efficiency, just packing this superhighway of essential structures into the smallest possible space. It's a true masterpiece of biological engineering, but it's also a built-in point of vulnerability. And that leaves you with a final thought, doesn't it? What other hidden critical worlds, just like this one, exist inside all of us?